Okay, now let's move on to the illustrious Droplet precautions. And here you will notice it says surgical mask within 3 feet of the patient. Now be careful. You don't want to forget the little precautions I taught you. You don't want to do this. Wait a minute now. Hold on. 1, 2, 3. Oops, let me go get my mask. No, what did we say about this PPE? You got to put it on before you go in the room. So we're assuming you might be within 3 feet of the patient when you're in there doing whatever the hell you're doing. So you put it on before you even walked in the room. Maybe in this encounter with the patient, you didn't even get within 3 feet. So what? You still put it on before you go in the room. And remember that it is disposable. So you threw it away before you walked up out that room, correct? And all it is doing is it's providing a barrier, and it's going to filter expired air. That's all it's doing. And so when you look at this category, I, of course, did what maybe was really old-fashioned for me, because I graduated in the 80s, right? So respiratory precautions was what we used to call it. And you may still see that. Respiratory precautions. They may not say Droplet, they may say respiratory precautions, some of these older institutions. And when you think about it, it's all your respiratory conditions. Pneumonia, for instance, common sense, right? You know that with pneumonia, it is the #1 complication of the flu. You should also know that pneumonia can have as its complication ARDS. With pneumonia, you know that this diagnosis is done how? How do we diagnose pneumonia? That's going to be a beat down. Sputum culture. Watch it. You got that wrong. We diagnose pneumonia with a sputum culture. We work it up with an x-ray. It's not the same. Okay? Meningitis. Whoo! Extremely deadly condition. And you know that it fits under the neuro guidelines. So this patient is being watched for ICP. Diagnosis is done how? Lumbar puncture. Another name for lumbar puncture is what? Spinal tap. What position is your patient for this lumbar puncture? Lateral recumbent. For a lay person, that's called fetal position. Lateral recumbent, fetal position. We also do lumbar puncture sitting up. Most of us do. But on your exam, look for either one. It doesn't matter. They could ask you anything. Who knows? All right, so lumbar puncture. And then for meningitis, you know there's 2 different types. This is where things get tricky in your notes. Bacterial meningitis is Droplet. Viral meningitis is contact. The deadliest one is obviously bacterial. You can die within 24 hours. Now, one of my students who lets me tell you this, she's the one that painted the picture back here, basically telling you, quit trying to say, I don't know, when I come around the room, because it's not going to work. So she was one of those students when she was new. She said, I don't know. I said, oh, no. We don't do that. Because there's no I don't know on NCLEX. So you got to take an educated guess. And half the time you might be right. So you're not allowed to say, I don't know. So she painted that for me and brought it in. Now, she was 16 when she got meningitis. Her mother is a nurse. She took her daughter to the emergency room because she had a high fever, a severe headache. She felt terrible. Things didn't look good. They diagnosed her with the flu, told mom to watch her, give her some antipyretics, keep the fluids going, plenty of rest, all the stuff we know the flu is, treated with. And so Kelly went home. She laid on the couch. Her mother, as a nurse, knew that she was very sick, and so she's watching her. On the way home, 2 things happened. Number 1, she told her mom, Mom, be quiet, stop talking. You tell your mama to shut up. Anybody? If you do, see me after class. We got a conference. You don't tell mommy to stop talking. Why did she tell mommy stop talking? It was hurting her ears. It was making her headache worse. That's called phonophobia, right? So then she's like, Mom, the lights, it's too bright. Uh-oh. What is that called? Photophobia. This patient has all of that. So when did Kelly's mom freak out? Well, she freaked out when Kelly took a nap on the couch. And when Kelly woke up from the nap, she promptly projectile vomited. Oh, no. Her mother took her right back to the hospital. You know what I got a problem with? The first hospital visit. And I ain't even got a problem with the doctor. We know residents are out there. They're learning. You don't get an opportunity to learn over 4 or 8 years. You got to come out in 8 minutes and know your shit. The problem I have is with the nurse who took care of her and did the discharge teaching and did the admission. I got a problem with all of them. Because what should the nurse have done with this young lady when she did the history and the physical assessment? She should have said, can you do me a favor? Can you put your chin to your chest? It would have emitted the loudest scream you've ever heard because it's so painful. So when Kelly's mom took her back to the ER, that's exactly what the resident did. It was a different doctor. The first doctor sent her home with the flu. The second doctor said, honey, do me a favor. She didn't do much else. She just said, honey, do me a favor. She said, can you try to put your chin down to your chest? And then there the scream was. She said, oh gosh, set up for LP. What did she do with that information? How did she think it through? Severe headache, high fever, 16 years old. Age matters. Age matters. The number one age for meningitis is 16 to 21, with 18 being the peak. We lost 2 young ladies at Ohio University in the same dorm room, died from this condition. It's college, high school. And I don't know about you, but most of you, I think, you're so young, most of you have been in a dorm. And one of my daughters was at Spellman, and that dorm is older than all of y'all. And she couldn't even plug her curling iron up because the wattage on the electricity couldn't support it. It was a fun day, though, when we moved her in. It was very hot outside. And when we got to Atlanta and we rolled up that long historical driveway to do the whole move, I had rented the van. All of these rather nice-looking guys showed up, and they were from Morehouse. And they said, our ladies don't move anything. Go get your iced tea. And they moved all the ladies in that day. It's very nice. I don't know that that exists anymore. It was 30-some years ago, 20 years ago. So anyway, this kid's in the dorm, and she has 3 other people in there with her. How close are you in the dorm? Are you within 3 feet? How about 15 inches? How about bunk beds? How about ain't no space to breathe and you're going to fight the first semester? How about one of y'all going to move out or get beat up? You feeling me yet? Okay. Well, the second kid, many years later, she's there now because she's a professional freshman. She's at Ohio State, and when she went to Ohio State, she was a scholar, an honors scholar, so she had the fancy dorms. Okay, yeah, right. There was 5 of them in a room no bigger than this little area right here. 5 kids. I was like, oh my God, you don't look, if you're not careful, you're going to be in a microwave. So your dorms are so close quarters that you are very much at risk for if one of these sweethearts gets meningitis, they're all going to get it. Now you got to know that. Because here's what's going to happen. Don't we treat close contacts? We treat the patient with penicillin G. We treat close contacts with either rifampin or Cipro. So one of my little sweethearts, she was exposed, because she's an ER nurse, she was exposed to meningitis, active meningitis, bacterial meningitis. She said, yeah, they sent my ass home on Cipro. I said, well, good. Don't come near me. I know you work at the office. I don't want to see you. So she had to be treated because she was a close contact. Now, you had to know for your exam that if you have been on antibiotics for 24 hours, you are no longer considered contagious. Do you remember I taught you with test-taking strategies, watch numbers? So if they say admitted 2 days ago, that 2 days mattered. In this case, they're considered no longer contagious, correct? So it's only the person that has not been treated for 24 hours. So be very careful. Now, I will tell you this, Droplet Precautions does not ordinarily go in a private room, do they? But this does. And that's because obviously with the bright lights and the loud noises, what are we at risk for? A seizure, and seizure precaution patients go in a private room. That's what decreased stimulation means. Now, epiglottitis, oh boy. Epiglottitis sounds familiar. What did you have to know about this and 4 other conditions? Call the doctor first. Your first nursing action was call the doctor. Now let's just review for shits, kicks, and giggles what 5 conditions required that we call the doctor first. This epiglottitis is one of them. What's another one? Compartment syndrome with a cast. What if it's traction? Release the weights first, then call the doctor. Okay, so we have so far epiglottitis, compartment syndrome. What is another reason to call the doctor first? Consent form not signed, or the patient has no idea what you're doing. Okay, give me another one. Cataract surgery complaints. Patients had cataract surgery. Now they're complaining. Ain't nothing you can do. Call the doctor. What's another one? Ruptured uterus. Whoa, baby's free floating in the abdomen. What can you do? Not a damn thing. Call the doctor. Okay, so that's cool. Now, epiglottitis. Epiglottitis is the respiratory song. Let's just keep it real. This kid is so sick, they are at risk for dying. How much are they at risk for dying? So much so that you have a crash cart in the room. I'll say that again. So much so that you have a crash cart in the room. We don't see this as much as we used to because we have a vaccine. What's the name of that vaccine? HIB, Haemophilus influenza B, or HIB, H-I-B as in boy, HIB. Haemophilus influenza B vaccine protects against epiglottitis, recurrent ear infections, and even a little bit of meningitis. Okay, so you have this Haemophilus influenza B vaccine, so we don't see this as much, but when we do, OMG. Now, I won't make you sing, Lord knows, some of you don't know the song, but I will tell you for this respiratory song, which you better get up close and personal with it, because we're about to do this on the, this is on the next board for your next lecture. Okay, you have a pulse ox less than 90, a PaO2 less than 60, grunting, flaring, and retracting. You have tachy, which means tachycardia, tachypnea. You have shortness of breath and dyspnea. They mean the same thing, but it sounds like a good rhyme in the real song. If you've not seen the dancing that goes on here for years with this song, then you have missed a lot. Okay, and then the most important word, which is last, is what? Restlessness equals respiratory distress. Now, this kid has all of that, and then you need to add to that some more stuff. This kid has the respiratory song, and then you need to add to it the following. They're drooling because they can't swallow. Their epiglottis is inflamed. They can't swallow. They're drooling. They are in tripod position. Tripod position. So they're leaning forward, because if they lean back, they're going to occlude the airway. They have a severe sore throat. It's profound. They have a high fever. They have inspiratory stridor. Inspiratory stridor. They're sick as a dog. So you may still get these babies in, those who have not been vaccinated. You can still see this. It's just so rare. Now, you got some rules. What'd you learn in school? Not to do what? Don't open their mouth. Don't take an oral temperature. They don't need a throat culture. That's a big rule. Don't open this kid's mouth. What else did you learn in school you can't do with this kid? Can't lay them back. Can't cradle them. Can't lay them down. Can't lay them back at all. Got to keep them forward in tripod. Okay, so you can see his baby's really sick. And you called the doctor first. Why? Because you want to pick on him? Because this kid needs to be intubated yesterday. So we keep a trach set at the bedside. We've got our crash cart in the room. Everybody on the unit knows where to direct our doctors when they show up. Okay, so the crash cart, remember how crash carts go. Half the cart's outside the room, half the cart's in the room, so you have half of it in the hallway, so you kind of straddle the doorway, because then everybody that hits the unit sees the cart, they know where to go. Okay, so this kid is very, very sick. They have to be intubated, and they're going to need steroids, and they're going to need an oxygen tent, and all the rest.